really it is about the global work being done for improving the implementation of personalized medicine. So as we think about some of the challenges that the field faces in policy, in access, and in care delivery, really some of those policy challenges are unique depending on the country that you're talking about. But delivery and clinical care adoption and implementation of personalized medicine is a global phenomenon. So that's why I think it's very important for the Personalized Medicine Coalition, ICPerMed, and other groups to work towards global solutions. Once again, I want to thank Monica for inviting me to speak today. I want to thank the ICPerMed for our continued collaboration. And I want to thank all of you in the audience for your attention today. And hopefully we can continue to bring forward some new ideas as well as to support ideas that we've been working on for the past few years. So the title of this presentation, the person is about, I'll give a little introduction about the Personalized Medicine Coalition for those that are unfamiliar with our group, and then talk about our efforts in integrating personalized medicine into care. So the Personalized Medicine Coalition represents, as I mentioned, multiple stakeholders in the field of personalized medicine. And we are working under the assumption that believing in personalized medicine and that it will shift the way medicine is delivered does not necessarily happen just because the science and new technologies show very clearly that it has value and that it should be done that way. There are a lot of other steps we need to work towards: the policies, education, advocacy, and evidence development to show that personalized medicine is an improvement in the delivery of clinical care from traditional methods. All of these efforts are meant to drive healthcare delivery implementation strategies. And that's where the Personalized Medicine Coalition has evolved to. The coalition's been around for about 20 years, since the completion of the Human Genome Project in 2003, shortly after the coalition was developed. And in the beginning, the coalition really was dedicated to making the case for personalized medicine, describing what it was, educating policy decision makers and providers about this field of medicine. But I think we've moved a long way. And over the last 5 years, there's been a shift. The case for personalized medicine has been made. I think there's a strong recognition that this is a better way to deliver care, with diagnostic testing showing the best treatment strategies for individual patients. But we are now shifting towards understanding what are the challenges in delivering personalized medicine, and what can we do to improve those processes. So here's the precision oncology value proposition. So I'm going to focus on oncology here for this presentation, but really all of these concepts relate to all of personalized medicine, all of biomarker testing based care. So here's the precision oncology value proposition. And Monica said at the beginning, she didn't need to do an introduction on why personalized medicine, but here it is. By implementing personalized medicine, and in this case in oncology, we expect improved clinical outcomes, safer and more effective targeted therapies. And by improving those clinical outcomes, we expect that will lower systemic costs through improved efficiency, reduction in less effective treatment use, and reduction in adverse side effects. Navigating the relatively complex precision oncology pathway can lead to inefficiencies in implementing and unlocking the full potential of precision medicine, we have found. And although precision oncology is promising, currently the access issues for delivering personalized medicine are impeded because of an ill-prepared diagnostic and clinical care practices within our healthcare provider systems. So Personalized Medicine Coalition worked with a number of partners and a number of international partners to look at the issue. What are the practice gaps, the clinical practice gaps associated with biomarker testing informed personalized medicine strategies? Now, we focused on non-small cell lung cancer because that is where we're seeing perhaps one of the most robust precision oncology pathways. We used the Diaceutics Diagnostics Therapeutics Data Repository. Diaceutics, based in Belfast, Ireland, has a great data source that marries claims data, so what patients are receiving as far as treatments and technologies and services, and they married it to laboratory data, so we can see where the delivery of care matches with laboratory issues. And we examined where patients were falling out of receiving precision oncology along the precision oncology pathway. So the top line findings we'll get to is that we found overall that 644 out of every 1,000 newly diagnosed patients with non-small cell lung cancer did not receive a personalized treatment. So nearly 65% of newly diagnosed patients never received the most appropriate personalized treatment. That's unacceptable. We found that nearly 50% of these are lost to factors associated with biomarker testing. And for those that did get biomarker testing with actionable results, nearly 30% of those did not get prescribed the appropriate targeted therapy based on those biomarker test results. This is obviously unacceptable. So we analyzed 7 clinical steps along the precision oncology pathway to see what the impact was at each of these steps for patients being lost to the precision oncology approach. This included biopsy referral, biospecimen collection, pathology, biomarker test ordering, the test performance, the test result reporting, and then the treatment decision. And at each of these steps, some patients, their challenges about delivering care at each clinical practice gap led to the loss of some patients. Now, here are the more descriptive findings. The data was normalized to a patient population of 1,000 because this is a linear progression. So it's difficult to say what percentage of all patients were lost at the last steps because all of the patients at the earlier steps had already been lost. But you can see here that we're losing patients at every one of these clinical steps. Now, I'm going to point out a few of these just because I think, especially with this audience, for people who are involved in the delivery of personalized medicine and trying to develop strategies to better deliver personalized medicine, you'll see that these challenges are areas that we can make a difference. We can make changes that will improve the delivery of care. First, I'll point out practice gaps 2 and 3. Point out practice gaps 2 and 3, where we're looking at the pre-analytic processing of samples and biospecimens. Here we're losing, just in the biospecimen collection stage, 14.5% of all of patients because their biospecimens are botched at some point and they, when sent for testing, are unable to be used because they weren't handled appropriately. We're losing another 1.7% of patients because of the biospecimen evaluation and pathology step. These steps can be easily addressed just by looking at the CAP guidelines and making sure that there are better processes in place to make sure and ensure quality control at the biospecimen processing stage. Looking at practice gap 4, you'll see that another 18% of patients are lost because they never received a biomarker test order at all. We're losing another 18% because the biomarker testing performance was off. And a lot of that has to do with false positives and false negatives, primarily false negatives, because of biospecimen testing processes that failed to give an appropriate result. We're losing 4% of patients because of turnaround time. And most importantly, and this is where we're seeing the greatest loss of patients, is even if you've made it through all of the 6 stages with your biospecimen, we're seeing another 30% of those patients where they get a usable biomarker test result and they're not getting the appropriate treatment assigned based on that result. And that could be for a number of reasons, but clearly unacceptable. This is leading to a number of technologies that are improved, that are needlessly sitting on the shelf. And of course, most importantly, patients that are not receiving optimal treatment, that are losing, their disease is progressing and they're losing life years based on these suboptimal practices. Now, I will tell you that we're doing an update. The data here was from 2019, and we're working with Diaceutics to do an update, and I'll give you the early results. We have not published yet, but in using data from 2023, we found that there has been an improvement in the biomarker testing stages. We're seeing an improvement of 11% more patients are receiving biomarker testing and getting results. But we're also seeing that this gap, where we're seeing 30% of patients at the 7th practice gap that are not getting the appropriate treatment decision, has increased to 43%, leading to, after 4 years, virtually the same amount of patients that aren't receiving personalized medicine, but the practice challenges are shifting. So what do we do? I worked with colleagues, pathologists and oncologists in the United States to develop a baseline set of strategies where we can improve care at each of those steps. And we published that in JCO Oncology Practice in 2024. This has led to just the foundation of a larger project, implementing precision oncology, development of a roadmap for addressing clinical practice gaps and streamlining the delivery of personalized medicine. Here in this study, we're looking at best clinical practices, best education programs that will be needed to make sure that we deliver care appropriately, and for addressing access challenges around coverage, reimbursement, affordability that are underpinning personalized medicine. We wanted to make sure that this was a global effort because these challenges, while the impact and magnitude of each challenge may differ depending on healthcare delivery system and healthcare delivery region, these are the same challenges that we all face. So the strategic roadmap policy is looking like this, and I've got some examples on the right-hand side of this slide. First, we must identify the clinical practice gaps, and that we have done already. For example, the appropriate biomarker testing was not ordered or treatment began before testing was ordered. Next, we need to all agree upon clinical practice goals. We've put together an international project steering committee to do just this. For example, what is needed to address that biomarker testing order challenge? The steering committee devised this practice goal: complete broad-based biomarker testing in concordance with clinical guidelines is ordered for all patients reflexively upon diagnosis. Again, this is lung cancer. This does not happen currently, and this should, and this would improve the delivery of precision oncology care. What are our strategies to achieve those goals? We're working with the community, and part of why I'm speaking with you today is to help devise those strategies. For example, to standardize and incentivize reflexive testing, to ensure that inline electronic medical record alerts for biomarker testing are included, and to harmonize clinical guidelines. There are many strategies for each of these clinical practice gaps. These are just some examples. Where we are now is developing and promoting high impact programs. The key thing here is that a number of programs and initiatives are underway globally in the United States, in Europe, and through the rest of the world to address some of these practice gaps. But we're not sure what each other is doing in many cases. So what the Personalized Medicine Coalition is doing, and where we want to work with ICPerMed and other partners, is to catalog all of these high impact efforts that your groups are working on, so that we can align and support one another and bring forward together these strategic programs, these strategic elements that will help the delivery of precision medicine. And the final step is to take action, to create health system pilot projects, to partner with health systems to enact and implement our strategies for improved care, and to coordinate national and international standard quality measures. Again, just some examples of what we can do together. Now, this is a global effort. You see some of the partners we've already working with. The necessity to work with a group like ICPerMed to gather all of the feedback from Europe and make it part of a global project. And then to bring it back to the PMC and work in partnership with us to move these strategies forward. Some of the groups that we're working with are listed here. This is the international group, because I figured that for this audience, many of you would be familiar with some of these. It includes patient groups. We're very close and are working closely with IATRIS, the European Translational Research Institute, and a number of other programs and projects that are working towards improved strategies for delivery of precision medicine. So I'll wrap it up here. Here are the references to the two articles that I mentioned on practice gaps and strategies. But I'll end with a call to all of you to reach out to me at this email address below. If you want to get involved, or if you see a real opportunity to showcase and highlight and work with us to improve the delivery of personalized medicine. So with that, Monica, I'll turn it over and take questions, or just begin the discussion.